Hello and welcome to this very special episode of Frankly Speaking. And joining me tonight is Dr. Surjit Bhalla, India's Executive Director in the International Monetary Fund, looking after not just India but also Bangladesh, Sri Lanka and Bhutan. Thank you for joining us on Frankly Speaking, Dr. Surjit Bhalla. Even as India is experiencing the worst ever phase of COVID-19 since the epidemic broke out last year, sometime in February, March. We're in the throes of a second wave that has been much worse than the first wave that India has experienced. The question many in India are asking, was there not enough research and forecasting models that were available to understand and project the kind of impact this second wave would have had on India? Has this taken us completely by surprise in the way it's unfolded?
Yes. To the first question, basically what should be communicated and what is a fact is that this second wave has taken the world by surprise. We are not alone in being taken by surprise. The maximum amount of daily cases in the second wave is higher than the maximum amount all of last year in several 40, 50 countries around the world. So the question is a very legitimate one. What do we know about the causes of the second wave? A lot of research is going on now in terms of genome sequencing, etc. And could we have been better prepared? There is no question, looking at hindsight, that we should have been better prepared. But the question is whether there was information available at the time before the crisis. And as you know, the cases in India had really collapsed, and so much so that in a research paper that I did, I said that maybe we are reaching herd immunity. So that is where we were 3 months ago. And there wasn't anybody challenging that view that maybe we had. Now, the same story about whether the crisis was over was being played out in other countries, developed countries and developing countries. As you notice, France went into a lockdown. Japan just went into a lockdown last night. This is a worldwide phenomenon like the first one. And we should all make efforts to find out first what has happened. Actually, that's not the first. The good news this year compared to the second wave, compared to the first wave, is that we have vaccines. And I think that's where the maximum stress should be. We'll worry about the identification of causes and what happens and what determines what. But right now, I think the utmost attention around the world should be on the provision and of vaccines and jabbing. That is the number one priority. And in addition to that, or related to that, is the fact that there are several people, thousands, you said, 300,000 in a day and in a million in a week. Many of them are seriously ill. You know the whole story about the lack of oxygen, lack of treatment, lack of hospital beds. So this is a crisis that we certainly have never seen before of this magnitude. And so I think we have to move on two major fronts. First, to take care, obviously, of those who are sick and ill and try and prevent the further contagion of this virus. And second, and very much related to it, on which I would think the government should put the utmost emphasis after the emphasis on saving lives, is vaccination.
Well, Dr. Surjit Bhalla, you're right. There have been 3 lakh plus cases for 3 days, 3.5 days. We've touched 1 million new cases of positive COVID virus infections in this country. But the bigger problem is that there is not enough testing that is going on in several states. The mortality rate, which is at a 1.1%, much lower than what we saw in the first wave, are many people saying that these are fudged numbers, not the real numbers, because the real deaths and the real mortality is not even being reported. The question here is, did we slacken up in the middle 4 months of respite that we had? Because we had seen countries like United Kingdom, we had seen the United States, several other countries in Europe going through a second phase. Yet we did not anticipate in India that there would be a second wave, and we got involved in business as usual of politics and elections.
Well, I think those are very legitimate questions about anticipation, and they are being asked, and they will be asked, and will continue to be asked. All I want to say is that I've been researching, other researchers have been doing. There's a whole army of people, researchers who are looking into this, scientists, economists, epidemiologists, etc. And before the second wave struck, whether here or anywhere else, the world was complacent. And, you can say the whole class failed and the whole class did fail. Nowhere do I know where the second, if you were not complacent, then you would have prevented in some way or prevented the extreme form of this virus, that is the hospitalization and the deaths. Now, as you rightly mentioned, 1 million cases over 3 days, and we don't have the exact medical facilities that developed countries have. We have good medical facilities, but clearly nowhere matched to what the developed countries. So, as I mentioned, France went into a lockdown 3 weeks ago. So if they had anticipated, they wouldn't have gone into a lockdown. And so I think, it's very legitimate and to ask as to why we did not anticipate. I think, but right now, my emphasis and what I think a lot of people are emphasizing, help is on its way in the form of vaccines. And in that context, it's a bit disturbing for politicians or whoever stating that, look, we don't need vaccines or we can't trust the vaccines. I think the major effort of the government should be in trying to make access to vaccines completely free, as well as, and you mentioned testing, that it's not so much a testing of whether you've got the virus or not, but the associated testing, which is called testing for genome sequencing, where we can then identify the variants and see whether it's a new variant, old variant. This will help in terms of the vaccines that are then developed, as well as identify what is going on. So I think that's where the emphasis is around the world and also in India. But I think the government should make sure that all resources are made available for genome testing, regular testing, as well as for the distribution and availability of vaccines.
Dr. Surjit Bhalla, I want to ask you, even on the vaccine front, the fact of the matter is we were depending on 2 vaccines, the AstraZeneca Covishield and the biotech Covaxin. It is only after the second wave came in impacted India, the manner in which in the manner in which it has, the liberalized vaccine policy came in. That's when we suddenly realized that our numbers are so huge, 137 crore of Indians, that whether it is hospital infrastructure, testing infrastructure, oxygen availability, availability of medicines like remdesivir and others, we were falling short in every possible way. Even if our numbers were highest in terms of vaccinating, the fact is, compared to our population, the proportion was very small. The liberalized policy now comes in. We've been through that phase where opposition parties have questioned the efficacy of vaccines, presented their doubts with the vaccine. But the fact is, overnight, we've had to change. Now we want to go in for Pfizer, we want to go in for Johnson, we want to go in for Moderna. Do you think we have delayed this liberalized vaccine policy for too late? Because now trying to import all of this will have logistics and time issues involved. And in the meantime, it's almost like a time bomb that is ticking in terms of the number of infections that are going up.
Well, you know that Poonawalla from the Serum Institute wrote an open letter to the President of the United States asking that the export of raw materials, quote unquote, for the vaccines to India be liberalized or be allowed. And I think that's one of the questions coming up all over as to why the US, which has an excess of vaccines, and just last week, vaccine acceptance or the number of jabs fell by 11%. And the US doesn't have an emergency like India. And so therefore it is hoped that the raw materials which go into the manufacture of vaccines is made available. And so this is another question that we have. Now, on the efficacy of vaccines, take even AstraZeneca and what researcher IMRB and what the research has shown, or the data has shown, that even though you may get COVID again with the vaccine, that the rate of hospitalizations and the rate of deaths is close to zero. So in other words, even in the worst case scenario of taking the vaccines, AstraZeneca even, that it you're really attacking part of the problem and, if you will, preventing the worst forms of the problem. So I think whether, in terms of public acceptance, in terms of political acceptance, that the stress should be on vaccinating as many people as possible, as quickly as possible. And research which we'll be publishing does show that it is quite effective in lowering, even at these times, that those states that have vaccinated more show a lower jump in cases. So, it is as I said, there is, as you said, and as all of us, a crisis like this, an emergency like this, a health emergency, which is worse than any other form of emergency. We have never witnessed this before. So this is new to the system, and we should really go all out to prevent deaths, to prevent hospitalizations, and eventually to prevent further cases.
Dr. Bhalla, you wrote a piece, and in that piece, there was this whole debate in India about, the Kumbh Mela that was taking place in Uttarakhand. And in your piece, you wrote about the fact that, the infection rates were not high in states where such super spreader events were happening than in other states. So frankly, pointing fingers at some of these activities like rallies, election rallies and Kumbh Melas were probably, issues that were being raised politically. I want to ask you, Dr. Surjit Bhalla, do you really believe that these events like election rallies, the road shows, the Kumbh Mela did not add fuel to fire of the existing number of COVID cases in the country?
A very good question again, and it is something that, let's just take the history of the evidence that has been put forth by the medical community. We first thought, the medical community stressed that lockdowns was a way to prevent, to contain the virus. And about 130, 140 countries around the world went into lockdowns. Now, they went into lockdown somewhere in March, most of the countries, and we have this data available. Oxford University publishes this on a daily basis. And we saw that there was an explosion of cases worldwide. So lockdowns didn't work. And then after that, we mentioned in the article about masks and social distancing, and whether that has worked. And, what we have, again, this is a matter of evidence, and looking at the evidence goes both ways. But the real stress of the evidence is that we don't know what works and what doesn't work in terms of or what causes the virus and the spread of the virus. You have umpteen number of cases, and that's what we try to point out, where you've had election rallies, but Delhi is now witnessing some of the worst, and Mumbai and Maharashtra has witnessed the worst. So I think what we emphasize in the article, let us all be a bit humble. And that's the key point, that look, there is this evidence, and because of the tragedy, we all jump to various conclusions and we all upset. It's very legitimate to be upset given the magnitude of this tragedy. But that doesn't mean that we know if we hadn't done. So your question, legitimate question, if we didn't have the election rallies in West Bengal, would Delhi have had less cases? That's the question to ask. And I don't think there is evidence to suggest that, or convincing evidence, that, you have bits and pieces here and there to suggest that election rallies in Assam or in West Bengal caused the cases, or in Kerala or Tamil Nadu caused the cases in Delhi and Maharashtra to zoom to what you're now saying and what we've now observed, 1 million cases in 3.5 days. If we knew that this was the determinant, then we would have solved, the world would have solved this problem long time back. And they did try to solve this problem long time back by enforcing lockdowns. Every country in the world literally went into a lockdown. And in every country in the world, cases exploded. So I'm saying, be humble. We don't know. And the evidence is not there. Everybody is picking and choosing the evidence that they think conforms to their priors. I think, I'm honest to say, I've looked at a lot of evidence. I've concluded mistakenly, which I said in the article, or we said in the article, that we had reached or maybe reaching herd immunity. And look where we are 3 months or 4 months after the article was written. Explosion. So I don't know. I honestly don't know. And there's a lot of now evidence coming out, and previously there wasn't, that the quick fire, identification of causes is really not backed by strong evidence. What is backed by strong evidence is vaccines. We know that prior to the COVID cases, and we are knowing that now around the world. There was a recent article in the Financial Times documenting how the vaccines have worked. And our article coming out on Monday will also document how the vaccines have worked in India to the limited extent that they have been made available. So the lesson from all of that is we should really try and purchase, allow, and it's very good that the government has now liberalized imports. I think we should really also liberalize imports and funding for identification of genome sequencing. No money should be, is too little in order to learn about this disease and to purchase and to distribute vaccines. We know that works. And that is why it's a bit disturbing for politicians, etc., to score points in saying we won't take this vaccine because it's a BJP vaccine or a Congress vaccine or whatever. Look, we know that works.
Dr. Bhalla, we've spent many a budget in our studios, debating how good are various models and propositions made by economists. Well, they're as good as the assumptions that they're based on. And your paper was based on an assumption which considered data up to 31st of January. Now, up to 31st of January, if you look at it, frankly, everything was pretty much under control in India.
Let me interrupt.
The fact that there has been a 6,000... fact that there has been a 6,000% increase in West Bengal infection rates, 450% increase in Uttarakhand infection rates, are these incidental numbers, or would they change if the assumption date of January 31st was changed?
First of all, I just want to correct. The data was not based till January 31st. The data was all based used till April 15th. Okay, so what the January 31st comes is we are trying to estimate what would have been predicted by a model which used information only till January 31st, but the prediction is till today. So we look at the cases, actual number of cases. What you're saying, we have the data till April 15th. Now we have the data for 10 more days. But we didn't omit any data. We're looking at the data as is available and trying to see if what we knew, as you rightly said, January 31st, we didn't have the new wave. And everybody was complacent, including us. So what would the information available on January 31st have predicted for each of these states on April 15th? And then we look at what was actually observed in these states April 15th, and then we look at where it is higher and where it is lower.
All right. Dr. Bhalla, in India, there's a huge debate that is going on the political front where the states say it was the center's job to predict what would be the magnitude of the second wave, which it didn't do. The state, on the other hand, says that the states also did not have their hand on the pulse of the way the infections were moving in their own states. Where do you think really the slip really lies? With the states or with the center?
Okay, look, this debate at the present, and that was the point of the article. We don't know, stop the blame game. Let's try and address the problem, the tragedy of the problem. Let's try and solve the problem and make lives more livable. So we can go into whether it's the state and the center. As you know, it's a state subject. Healthcare and education are state subjects, but the center is also the center. We can get into those blames later. Right now, we don't know what caused this excess wave. The world doesn't know. If the world knew, the scientists in the world knew, nobody would have had the second wave. There's a Mexican variant, there's a South African variant, etc. Hence, the emphasis on genome sequencing, on identifying the strains, testing, in order to identify not only that you've got the virus, but which virus you've got and the distribution of vaccines. That's where the maximum stress should be, whether it's by the state or the center or the global community, including the US.
So, Dr. Bhalla, this is India and debates are raging on several different subjects. And the latest subject of debate is on the issue of vaccines and the differential pricing of vaccines. Well, in the first phase, there were, government hospitals providing vaccines for free. When it was being provided in private hospitals, it was at the cost of rupees 250 per vaccine that was being given out mostly by AstraZeneca in private hospitals. Now with the scope of the vaccination policy being enlarged to include the age group of 18 to 44 as well, we're talking about 51 crore people. States have come up and actually questioned the policy, the pricing policy for this, where it is being talked of a differential pricing policy for 400 and 600 rupees has been offered by AstraZeneca and the Serum Institute of India. I want to ask you, states feel that there is a stepmotherly treatment. Do you think this burden of cost actually should be borne by the center as the states are suggesting? Or do states also have to participate in picking up the financial tab of this countrywide vaccination program?
From my vantage point or from my experience as an economist, this is one of the easier questions to answer in these tragic times. Vaccines is the ultimate public good. What we know, all our experience and all our knowledge, and there is no ambiguity about this knowledge, is that the public good has to be financed by governments, domestic or international. Within governments, it is state governments and the center governments. They work together, and I'm hoping that they work together on this one. Nobody should have to pay for a vaccine. If you ask my view as an economist, nobody should have to pay for a vaccine, and the state and the center should absolutely work out. We've got the GST where the state and center works out. The state and center have been working with each other for the last 70 plus years. So this is not new that they have to work together, but they have to. I can't say there's any basis, logical basis, that only the state should bear the expense, or any logical basis to say that only the center should bear the expense. Obviously both, and the international community has to bear the expense. The World Bank, there are international organizations, the IMF, and both these organizations are going out and providing vaccines to people. So, and India also, in the early phases when we didn't have many cases, we also provided vaccines to poorer countries. This is a global problem, and let's not get into, and I don't think, quite honestly, it makes any sense whatsoever that the state should do it, the center should do it, the US should do it, the World Bank should do it. We are all in this together. That's the amazing nature of this pandemic. And all of us, and we have formulas, we have estimates, much better than the epidemiological estimate about how much the virus will be or not. The question now is, we have technology, which we didn't have before, that is the vaccine, and we have the resources. The world has the resources. And it should not be in a game of whether X has resources and how much X should give. It should be the world as a community. There are much poorer countries than India. There are much richer countries than India. And we all have to pool our resources to address this pandemic. And that's why my stress at the beginning for the US to stop, how cruel can it be that you are stopping the export where people are paying for it of raw materials, etc., that go into the making of vaccines? These are the questions we should all be asking, rather than the state or the center. Both. And nobody should have to pay for a vaccine. You may have, from an income distribution point of view, the only rich pay, but the target should be nobody has to pay for a vaccine, because I'm a rich person. I don't get, for vaccine hesitancy, I don't get myself vaccinated. I'm hurting the next person around. So it's a straightforward, everybody should have the vaccine. Everybody should have it available free. And you can then tax from other methods to get the money. The world, again, it's not the Indian deficit, it's not the US deficit, it's not the Israeli deficit. It is a deficit of unity that is the real big deficit today.
Dr. Bhalla, people are also questioning, should money be actually put into just the vaccine policy to vaccinate every single Indian, or taking away money from projects which the opposition have called absolutely wasteful expenditure, like the Central Vista project. Do you think, in a situation like this, where the government has argued that the Central Vista is not something just about a showpiece, it's also about creating jobs, it's also about, manifestation of India. But do you think in the middle of a pandemic, emphasis should move away from projects like Central Vista? That's another debate that's currently raging right here.
The World Bank and the IMF, and they have all come up with estimates. The world is coming up with estimates as to how much money is needed and how many people need to be vaccinated. It's not 100%. It is, basically there is a level
60 to 70%.
So it's about 60, 70% of the population. Again, we can go into, okay, should money be taken out of cancer research in order to fund this? Or should money be taken out of vistas? Or should money be taken out of railways? Or should money be taken out of infrastructure? I personally don't think that's a meaningful question. It is whatever is needed right now to address this problem, not just in India, but worldwide. That is the number one focus for all of us in the world. And not worry about whether this will, the state has to pay, the center has to pay, or whether you need to take, this is a political debate. You can pick any such. And economists have dealt with this all the time. You basically address this most serious problem right now, and then worry about the other problems. In the olden days, they used to worry, oh my God, if I spend money on this, there'll be inflation, or if I have a higher fiscal deficit, there'll be inflation. Most countries around the world, including India, has, if you will, thankfully, not gone that route. So I don't think money is a problem in terms of attacking the virus. And it should not be a problem, and it is not a problem.
In these times, do you think, so far the government has followed the strategy of local containment zones, and for states to take their own decisions on which areas do they want to impose lockdowns on, and whether the lockdowns have to be shorter, do they have to be for weekends or night curfews, various models in various states. Do you think India is in a position where it can avoid a lockdown given the scale of infection that we are seeing, and the fact that the peak is still about at least 3 weeks away?
Okay. Again, Navika, it is a good question, and something I've been working on for the better part of a year. And these are my personal views, as well as my joint authors, and there are 3 of them. And the one conviction, the one thing I feel there's very strong evidence is that lockdowns don't work. So I hope that answers your question. And night curfews, so what? The virus takes a rest at night and stays home with you? I don't think any of this makes sense. So that's my private personal view based on research, but people can have different views. A direct answer to your question and a firm answer to your question is that we should not engage in any form of lockdowns whatsoever.
But given our numbers, our population, and the fact that we are a country where discipline is hard to impose, would we be able to manage the situation that we're currently in with infrastructure, the way it is, the fact that we don't even have oxygen supplies, we don't have cryogenic tankers to carry and transport oxygen, the fact that hospital beds, ICUs, ventilators, everything seems to be in short supply, and discipline is definitely in the shortest supply possible. Given such a situation, do you think we'll be able to manage and tide over this particular issue?
What we should do, and to a certain extent, the world has come around to this view, is to ensure safety, and within safety, it is, for example, if you impose a lockdown, there are costs to it, not just to the economy, the costs in terms of health. It is not at all evident that a lockdown will lower the virus. We've seen that in 150 countries in the world. They all imposed lockdowns. What happened? This is the first wave. So if it didn't succeed in 150 plus countries in the first phase, the only country where we know a lockdown worked is China. And, that's one piece of evidence, but where is the rest? So right now, Australia, where things had worked, yesterday in Perth, they've had all kinds of lockdowns. And now suddenly the virus is splurging there. So look, vaccines is important, oxygen supply, medical supply, those are important. That's where the concentration should be. How is the lockdown going to help? If the first argument was lockdowns will spread lower, you'll have the same number of cases, but you'll have spread it over a longer period of time. We saw that was not true. My only plea is let's look at the evidence. And I've written several articles on this. So that is not. So look, we can go back and forth. We are all frustrated. We are all upset, as we should be. And so what is to be done now? To be done now is, as I said, as I've emphasized, is testing as well as vaccine distribution. And then helping and simultaneously helping those most in need. And not worry about whether the state should pay or the center should pay. They should sit out. How long does it take for state and center to reach an agreement? And if it doesn't, then is it political? Are states playing games? Is the center playing games? I don't know. But what we do know is this is what needs to be done.
Do you think with the second wave hitting India just so hard, this budget is going to be enough?
What we are hoping, and the big savior is vaccines. So this is not expected to last several months and have the impact after that. There were major policies in the budget, and those policies, I hope and I do believe, will continue. They don't have much to do with a virus. They have to do with an environment when you don't have the virus.
Dr. Bhalla, I just want to ask you, you had commented and you had praised the budget presented just, less than 2 months ago. And it already seems like a long time. And you had said that it is a great direction, that it has taken a direction that was different from earlier. Do you think with the second wave hitting India just so hard, this budget is going to be enough? Is it going to upset the plans for India's growth story, which was seemed to be recovering? Or do you think it's going to take an economic toll on our GDP performance and overall on our real growth story, which we were seemed to playing catch up with?
And, the same question, as I said, is being asked around the world. And again, an important question, not as important as the distribution of vaccines, but important. And, you've seen the various economists, various investment houses lower the GDP growth forecast by anywhere from, the range was 10 to 12, and now most of them are between 10 and 11. What we are hoping, and the big savior is vaccines. So this is not expected to last several months and have the impact after that. So I think most estimates, again, whether they turn out to be right or wrong, is a matter that we can revisit. But most estimates suggest that by mid-May, we should have passed the peak. So there is a cost to the economy, and this is much of less importance than the cost to people's lives. But there is a cost to the Indian economy, and we'll have maybe, as I said, the other estimates are the GDP growth is 10% rather than 12%. And I don't think that says anything about whether the budget was worthwhile or not. There were major policies in the budget, and those policies, I hope and I do believe, will continue. They don't have much to do with a virus. They have to do with an environment when you don't have the virus. And I'm hoping and praying that we are in that environment by late May, where we get back to other major issues, having put the vaccine distribution in play, and will continue. So every day matters, every day vaccinations matter. And the economy is, we will all recover around the world. Look at Bangladesh, our neighbors, Sri Lanka, wherever. This is an impact, but we are coming out of it, and the reason the world is coming out of it is because we now have a vaccine. Previously, it was a pipe dream to have a vaccine within a year. This is now very real, and this is the really good news amidst all of this very bad news.
So, Dr. Bhalla, just before I sign off, I just want to ask you, in 5 words, what would be your advice to India today?
Increase, emphasize the distribution of vaccine, and do everything possible on an emergency basis to help those most in need now. And they are a large number, as you said, 1 million in a week or 3-4 days. So I think we have to look at it on both fronts. In one line, attack the problem and save lives.
Well, thank you very much, Dr. Bhalla, for joining me on Frankly Speaking. I hope we are battle ready to follow the directions that you have given. Thank you for joining me.